Hi, everybody. I wanted to reach back out with you again and talk to you about another one of our members. Dr. Cynthia Villacis is with Health Connections Direct Primary Care in Crestview Hills, Kentucky. I've known Dr. Villacis for a couple of years now, and she's got a really interesting practice, and I can't wait for everybody to hear about it. So thank you for allowing me to record you and record our conversation, and I'm excited to hear about it. So tell me a little bit about your background and what made you start this company.
Okay, great. So, yeah, I finished residency here at St. E's actually back in 2002. So I've been out and practicing for a while. And I've spent most of my time actually working in the community health centers over on the Ohio side. And through my work there, I found that patients never like quite had the time that I thought they needed to get their care addressed in the best way. And as I was trying to figure out another way to do this, I found about a practice style called direct primary care, and talked to my husband about it and decided I wanted to go into business for myself. And that was back in 2017. And so this is what I'm doing. It's called direct primary care, and it's set up to provide a more personalized access as far as for patients, so that they can have the time that they need in a way that's convenient for them.
So how does it, and I'm familiar in a sense, there's not a lot of physicians like you, especially in our area, that do this type of medicine, that provide the type of medicine and payment plans that you do, and on a more personal level. Tell me a little bit about how you actually work that way.
Okay, yeah, great. So it is a monthly membership. Okay, so it's a membership style medicine. There are some people who've not heard of direct primary care, may have heard of concierge, and it's similar in some ways,
Mhm.
but the price point is much more accessible. So with a concierge, that typically runs a couple $1,000s a year. Frequently, there's a year-long contract, and they tend to bill your insurance in addition. And with direct primary care, it's depends on the office, because most of us are independent, but there's about 1,200 or so offices nationwide now. So we're growing, and most of us are independent.
Mhm.
Average price point is $80 a month.
Wow.
And then there aren't any additional per visit charges. Most of us schedule a half hour for patients, and we limit our patient panel size so that we can really get to know the patients and more directly be able to address what their needs are.
So that's actually a 30-minute visit is really, you don't see that very often.
No, no, and the idea that patients need more time than what they can get in a traditional practice is
Mhm.
really what drove me to opening.
Okay, okay. So do you see what's the biggest benefit in doing more of a direct primary care than it would be for like one of the group practices that are in our area?
Yeah, so I think the biggest, well, there are a lot of benefits, but I think the biggest benefit is having a doc who knows you and is able to work with you on whatever your concerns are.
Mhm.
That isn't just having to rush in and out and have a lot of boxes to check about things that some third party think maybe what's important, which really may have absolutely nothing to do with your needs.
Okay, okay. So if I were to be a patient of yours
Mhm,
and my daughter were to be a patient of yours, and I only come in like maybe 2 or 3 times a year,
mhm.
but my daughter maybe comes in 10 or 12 times a year. Is
Yeah.
there a certain charge more for her because she's visiting more than there would be for me, or do we each have our own monthly fee? Does that make
Yeah,
sense?
it's the monthly fee is the same for everybody. If you see me, 3 or 4 times in a month, or if I'm talking to you once a day for 2 weeks because you got something really
Oh,
bad going on,
okay.
or if I'm seeing you once or twice a year, it's the same price. It really depends on the person. The average person, we have some sort of a contact or visit, 3 or 4 times a year, but it's really variable.
Okay, okay. So it doesn't matter if you come in 10 times. If I'm talking to you, whether it's video or calling or stopping into your office, 10 times a month versus or a year versus 3 times a year.
No, and I mean, there's some things that we're talking about, recently as far as like with the COVID-19 and stuff, and like, that is like handled at home most of the time.
Right.
80%
Okay.
of people don't have to be admitted and have what are called, mild symptoms. Well, those mild symptoms aren't necessarily mild, or they may be completely without symptoms. So if I
Right.
have somebody like that who's sick with something like that, then we're touching base once a day generally to make sure
Right.
everything's going okay. So.
So with the COVID-19 pandemic that's been going on, how has that affected your business?
Well, I've switched to doing almost all telemedicine visits.
Right.
And reason for that is to basically to try to protect everybody. If we're
Including
supposed to,
yourself.
including myself, because I mean, you don't know if you have something. I don't know if I have something,
Right.
you know, and neither one of us want to be given anything to the other person,
Yeah,
you know.
I understand that. So being a business owner and being a physician, how do you attract new clients, new patients?
Well, in general, it's word of mouth. You know, I mean, somebody knows somebody whose needs aren't being met through the
Hmm.
traditional system. A lot of times, it may be somebody who feels like they're not getting the time they need to talk about what they want.
Hmm.
They're seeing a different person every time they go in. They've had several doctors leave the practice, you know, over the last couple of years. I've had some patients who've like, well, I saw this doctor for my physical, but then I went back 6 months later and I had another one. And I went back the next year and I had somebody different. It's like, okay, if you've seen 2 or 3 doctors in a year and a half, that's not really continuity.
Very
And that's,
personalized.
yeah, so this is, a lot of people come because they want that.
Right. Okay. Okay. So what has been the most challenging that you've had since opening your doors in 2017?
The biggest challenge. I should have a good answer for this one.
It's
Um,
okay.
yeah, I mean, there's lots of challenges. I mean, there's
Do you
the
feel like people, because we are in an area where the practices are so, there's big group practices here. Do you feel that that's a challenge being like a privately owned?
well, I think it's harder to get the word out,
Mhm.
you know? So, I mean, there is an aspect of that.
Mhm.
I haven't had this recently, but when I first opened and I was having like an open house, I remember I had um, one lady who came in and I showed her around my office and um, she stopped by and she was like looking at the wall, like where my certificates were
Mhm.
are, you know, like saying, you know, I went to med school at Wright State, I'm board certified in family medicine.
Mhm.
And she was looking at that and she's like, so did you have to go to med school like everybody else? I'm like, wait a second, I've just been talking to you for like 15 minutes now. And
Right.
but she you know, had that idea in her mind that, you know, this was something different and was I really a real doctor?
Yeah, and I can get that. I mean, not that I think that everyone's brainwashed by how we think of what kind of like, you're supposed to always have insurance and you're supposed to do this. I can get that people are trying to understand it, but I can also see how much of a edge you have over these other family practices because you do make it personal. You know these people and you know their families and you know what's going on. You know who's getting married or whatever it is, you just make it personal, and I think that that feels really good. I think that feels
Yeah,
really good.
I think I think I enjoy being a doctor more in that
Uh-huh.
setup, and I think they enjoy, you know, having that kind of relationship.
Right, right.
Yeah.
So how do they get in touch with you if someone wants to reach out to you? Do they go on your website or call you or?
Well, they can check out my website. You know,
Okay.
that's an initial thing.
Uh-huh.
It's www.healthconnections with an S,
Uh-huh.
DPC as in directprimarycare.com.
Okay.
Or they can call me, and my number is 859
Okay.
905 0707.
Okay.
And you may get me. I do have a medical assistant. She's been working from home for several weeks now. That was
As
part of
we
that
all
whole
have.
transition. Exactly. So if I'm with a patient, either you know in person or with a teleconference, she may answer the phone.
Mhm. Okay.
But yeah, so that's how you get in touch with
Okay.
us.
So, Dr. Vices, as far as what everyone's going through right now with the pandemic,
Yeah.
of course, we all know that we're supposed to be staying inside, and we all know that we're supposed to be washing hands and wearing masks and whatever we're supposed to be doing. What is something else that you can tell us to do that will, I don't know if I want to say pass the time because I don't know, but staying healthy, and actually, mental health as well too, because it's tough.
Yeah.
It's tough to
It,
do this.
It is. I guess I would encourage people to while you're practicing the social distancing, you know, to remember that that's not socially isolating. You know,
Right.
you want to socially distance so you're not catching anything or passing anything, but you don't want to isolate yourself, because that's not healthy, and honestly, that's not as much fun,
Yeah.
you know? So
Yeah.
I would encourage people to try to access technology, that they have around them, for themselves, as well
Hmm.
as for people that they know. So, I mean, if you know somebody that, especially somebody that lives by themselves, I would encourage you to kind of reach out to them, because they're not going to be having as many people around them. So,
Right. Okay. Okay. Thank you so much for joining us. I wanted to find out real quick, where in Crestview Hills are you located?
okay. I am on Centerview Boulevard.
Okay.
I'm right next to, like, literally share a wall with the Northern Kentucky Bar Association.
Oh, yeah. Okay.
Um, okay, so I'm in those little condos that, if you know where Tri-State GI is,
Hmm.
big building on Centerview Boulevard.
Yeah.
It's the next group of buildings as you're going along Centerview Boulevard there.
Okay.
So,
Okay. Anything else that you can share with us before we say goodbye here?
just stay healthy at home, and get outside. Remember, staying at home doesn't mean you have to stay inside.
Thank you so much for joining us, and thank you for being a part of our group.
Yeah,
I think that
absolutely.
we're all going to get a lot out of it. So we will talk with you soon. Thank you
Yeah,
so much.
love to talk anytime.